Welcome to today's episode of Connecticut Paid Leave Spotlight. I am Amber Forrest and I am the Executive Assistant for Connecticut Paid Leave. Today, we will be discussing the different ways to take leave when you are considering applying for Connecticut Paid Leave benefits. This presentation is intended for anyone who is thinking about applying for Connecticut Paid Leave benefits, but isn't sure which type of leave they need or how their leave type may affect their benefit. Today, we'll review how each type of leave works so you may choose the one that is best aligned with you or your loved one's needs. There are three types of leave: continuous or block leave, reduced schedule leave, and intermittent leave. We will also review special rules for bonding leave, how the leave type affects the amount of benefits used per week, and how intermittent absence reporting works for Connecticut Paid Leave. Continuous leave, or block leave, is a one-time continuous absence for a single qualifying reason. This is the type of leave most people think of when they think about FMLA and paid leave. There is no statutory minimum length of time for block leave, but usually people will select continuous leave when they are expecting to be out for at least a few consecutive days. When you apply for benefits and when you apply for FMLA leave with your employer, you should be prepared to state the date that you expect your leave will begin, or the day it already started, and the date when you expect to return back to work, and you will not work at all during those dates. It is okay if you can only provide an estimate at the time you apply, but you will need to stay in touch with Connecticut Paid Leave and your employer to report more definitive information when you get it, or to request an extension of your leave time. A few examples of continuous or block leave are a 3-day inpatient hospital stay, a broken leg requiring surgery and recovery for 3 months, or participation in a 30-day outpatient substance abuse rehabilitation program. Intermittent leave is leave for a single qualifying reason taken in separate, non-consecutive time periods rather than a continuous block of time. While sometimes the need for intermittent leave may be known in advance, sometimes it could be unexpected, such as when you have a chronic health condition which causes flare-ups. An eligible employee may take intermittent leave in periods of weeks, days, hours, and even in some cases, segments of an hour. Employees may take the federal and Connecticut FMLA leave in the smallest increment of time the employer allows, as long as the smallest increment is no more than 1 hour. Even if the employer uses a time accounting system that can account for an employee's work time to the minute, the employer can establish a policy that federal and Connecticut FMLA leave must be taken in 15-minute increments. Examples of intermittent leave include leaving work early because of a chronic migraine headache, taking a parent to dialysis appointments weekly, or starting work 1 hour late once a week to attend physical therapy appointments. Frequency and duration helps us and you track your anticipated benefit usage. When you apply for intermittent FMLA leave and when you apply for Connecticut Paid Leave benefits in connection with intermittent leave, you will be asked to estimate the frequency and duration of the time off. In other words, how many absences do you anticipate having, and how long are you likely to be out for each absence? If you know you will need intermittent leave for a series of scheduled appointments, you can indicate the days of the appointments or the number of appointments if they haven't been scheduled yet, and the amount of time you'll need to take off from work to travel to and attend those appointments. If the intermittent leave is due to a chronic condition that causes flare-ups like migraines, your medical provider will be asked to estimate how often you tend to have such flare-ups, such as 3 times a month, and how long you're out of commission during each flare-up, perhaps 4 to 8 hours. Now let's go over the special rules for bonding leave. In connection with most leave reasons, you can decide how you need to take your leave, whether it is continuous leave, intermittent leave, or reduced schedule. With bonding leave, however, you have to talk with your employer and get your employer's approval to take bonding leave on an intermittent or reduced schedule. Because intermittent or reduced schedule leave for bonding is available only with the employer's consent, the following rules apply. The employer has the right to decide whether to allow it, how long to allow it to continue, and what schedule the employee must work. Of course, employers are expected to make these decisions on a case-by-case basis in a fair and equitable manner. If the employer's business needs are such that it cannot allow the employee to work on a reduced schedule at all, or can allow the reduced schedule for less than the requested amount of time, it is free to make that decision. An employer cannot deny an eligible employee the right to take bonding leave on a block basis. How the leave type affects the amount of benefits used per week. A work week is the employee's usual or normal schedule, hours and days per week prior to the start of the leave, whether that is 40, 25, or 48 hours per week. If you work for more than one covered employer, we count all of the hours worked from all of the covered employers you work for to calculate your work week. If your work schedule varies from week to week because of overtime or other reasons, we develop an average work week based on the hours and days worked on the 12 calendar weeks before you go on leave to calculate your work week. Connecticut Paid Leave provides up to 12 weeks of benefits in a 12-month period for most leave reasons. We use the rolling or look-back method for determining the 12-month period. This means the leave year for each entitlement begins on the first day the worker receives benefits from us, and the time is earned back on a day-by-day basis. Basically, you can only regain days as you took them in the prior year, not all at once. For example, if you take 1 day of leave on December 12th, 2024, and then 3 weeks of leave in March, 3 weeks of leave in May, 3 weeks of leave in June, and the remainder of the leave you have available in September, you would regain 1 day of leave on December 12th, 2025, but would have to wait until March to regain 3 more weeks, May to regain the next 3 weeks, and so on. This all means that the number of calendar weeks you receive benefits for depends on the type of leave you take. 12 weeks of benefits may not equal 12 calendar weeks based on your average work week. How much of the benefit is used with reduced schedule leave? If you are on a reduced schedule leave, your weekly Connecticut Paid Leave benefits will be reduced proportionally, both in terms of how much money you receive per week and how much of your entitlement you are using each week. First, we calculate what your average work week is when you are not on leave, and we calculate what your Connecticut Paid Leave benefits would have been if you were out for the full week. Lee usually works 4 days per week, 10 hours a day. Lee needs to take reduced schedule leave and can only work 5 hours a day for several weeks. On this reduced schedule, Lee is working 50% less than normal. Lee would be eligible to receive $600 a week in Connecticut Paid Leave benefits if taking a continuous leave. But because Lee's regular schedule is reduced by 50%, Lee's benefit is 50% of their total potential weekly benefit. In this example, $300 a week. Because Lee is only using 50% of their potential entitlement each calendar week, Lee could receive benefits for up to 24 calendar weeks. If Lee only needs to take reduced schedule leave for 6 weeks, they would be eligible to receive the same benefit. However, they are only using 50% of those 6 weeks, which would total 3 calendar weeks. Meaning, when this time for leave ends after 6 weeks, they will still have 9 of 12 weeks available with Connecticut Paid Leave. How much of the benefit is used in connection with intermittent leave? Pat usually works 5 days per week, 8 hours per day, but needs to take intermittent leave, expecting to take up to 2 hours a day, up to 5 times each month. Pat would be eligible to receive $900 a week in Connecticut Paid Leave benefits if taking a continuous leave. Because Pat's intermittent leave is variable, we calculate the total potential entitlement by multiplying Pat's average weekly hours by 12 weeks. 40 hours a week times 12 weeks equals 480 hours. We then calculate the hourly benefit rate by dividing the total potential weekly benefit by Pat's average work week. $900 per week divided by 40 hours worked per week equals $22.50 an hour. When Pat reports an intermittent absence, their bank of 480 potential hours of benefits available is reduced by the actual hours out of work. Their benefit payment is based on the actual hours out of work that week. If Pat were out of work for 4 hours in a particular week, the gross benefit payment for that week would be $90. If Pat were out for only 30 minutes in a particular week, the benefit payment would be $11.25. Reporting intermittent absences. Because intermittent absences are generally variable, they must be tracked per absence as opposed to those on a continuous or reduced schedule leave. Workers with an approved intermittent claim must report the date of the absence and the amount of time taken within 2 business days of the absence. The easiest way to report each absence is to access your case in the claim portal and click on the Add Time button. Thank you. For more information, please visit our website at ctpaidleave.org.